So let me first tell you about something that I'm working on that I think you'll be interested in, and that's healthcare. You heard Liam talk about the fact that I worked when I was in the United States Senate and House on the issue of welfare reform. That was done before all of you were born, almost. It was back in 1996. Welfare reform passed, and most of you, again, weren't around for that or even conscious of maybe even that happened. But back in the mid-90s, one of the big issues, in fact, Bill Clinton, back in 1992, ran on the issue of reforming welfare as we know it, because it was a program seen as out of control, lots of spending, not very good results, and it was a federal entitlement. There was a program called Aid to Families with Dependent Children, and it was started under FDR but morphed over the years to include providing funds for basically for moms who had children out of wedlock. Originally, it was for mothers whose fathers died, mothers whose husbands died, and we were going to provide aid to those families. And it exploded to be a system that allowed people to stay on welfare for long periods of time, generational welfare, no incentive to work, all these things that we as conservatives and really as Americans just didn't believe in. Well, Clinton, as a Democrat, said that he would reform. We took him up on it. And when we got control of the Congress back in 1994, I had worked on this bill when I was in the House. I got elected to the Senate that year. And we really worked on it. We ran into a roadblock among Republicans. We controlled the Congress. We ran into a roadblock among Republicans. Why? Because moderate Republicans, this should sound familiar, moderate Republicans don't like to vote for things that make them look mean, right? They don't want to be seen as mean, taking anything away from anybody, or at least the press and their Democratic opponents saying that they're being mean to grandma or mean to children or mean to moms or mean to anybody. And so we had a difficult time passing any reforms that made tough choices, that I used to call tough love. So we tried a different path. And that is, instead of us making decisions in Washington, we went out and started working with Republican governors across the country and said, we will give this problem to you and you can be mean. Well, moderates will vote for other people to be mean. They just won't vote for them to be mean. And so what we did is we put a block grant proposal together. We took all the money, changed the program, got rid of the entitlement. So no longer did you have a federal entitlement as a poor person to federal dollars. And we said, we'll put it in this big block of money. We'll give it to the states. And the states can then run the program based on a couple of rules that we put in place, but gave them pretty broad flexibility to run the program. What happened? Within 3 years, poverty went down to the lowest level that had been measured since it had been measured. Number one. Number two, people went back to work. The welfare rolls in some states. Anybody from Wisconsin? Okay. In Wisconsin, a governor named Tommy Thompson. He really took the bull by the horns, reduced his welfare rolls, ready for this? 92%. Okay? So, and he didn't just throw them off welfare. He put them into work, put them into education, put them into training, and moved them off welfare and into productive life. And this program, by the way, we put a block grant, a bunch of money, and that's how we figured, that was the deal, and this is really important to understand. So, moderates don't like to be mean. It's important for those of you who are going to be in the legislature someday and you're going to be working these things. Remember this one. Don't make moderates vote for things that make them look mean. Second, give them enough money if you can get good policy in exchange for the money. So what we did is we gave this policy of a block grant, put work requirements, time limits on welfare, had the governors go out and innovate. We knew that over time that was going to help people and it was going to save money. And in exchange for that, we gave the states a lot of money. How much money? More money they can possibly spend. Why do we have to do that? Because Bill Clinton vetoed the bill twice. And so we had to keep giving more money so Bill Clinton, who at the time was a moderate Democrat, was willing to sign it. And he did. So what happened? Well, since 1996, that block grant that we put in place in 1996, you know how many times we've increased the money on that block grant in 20 years? Never. And not a single governor ever complains. Why? Because we gave them so much money and they've reduced the rolls by so much, they're still with more money than they need, 20 years later. So we've saved an enormous amount of money. People have gone back to work. and we've reduced poverty. Pretty successful program. In fact, it's been the most successful program the Republicans have ever put forward and passed. It's the only time we actually follow through with a pledge to get rid of a federal entitlement. Well, here we are now with health care. And so what did we do? We didn't learn our lesson. The leaders of the House and Senate thought, we'll fix health care. And we'll put together our own bill, and we'll have federal laws, and we'll do federal things, and we'll take Obamacare and we'll fix it. Now, that's why you said we really didn't repeal Obamacare. We sort of just replaced it with something that is still federal control of health care and federal policies. And so what happened? Guess who wouldn't vote for that? Moderates who don't want to look like they're being mean. So moderates walked away, right? And that's what happened in the House. Moderates walked away. And eventually they got something passed, but watered down, and now they got to the Senate, same thing. Moderates wouldn't vote for it. So about 3 or 4 months ago, I on my own, just went to the White House, went to some members of Congress and said, it'd be good if we could remember some lessons from the past as to how to do these things. And look at it as, instead of trying to fix it in Washington, let's give it to the states. So over the past several months, I've been working with governors, and particularly Governor Scott Walker, who's the head of the RGA, another Wisconsin governor, and also folks like Governor Ducey, Governor Bryant from Mississippi, Governor Hutchinson, Governor Scott, and others. And we are working a package with the White House. The White House has engaged the governors now as of a week ago. And we are working very diligently on a Plan B. And here's my prediction. My prediction is within a couple of weeks, we will announce a Plan B, and within a month after that, we will pass it. And we will do something more than what anybody that we will abolish Obamacare, send that money, take all the money that Obamacare was spending, put it in one big block grant, send it to the states and said, you design your own insurance markets. You go out there and make a difference. So that is my update and prediction on healthcare, and I'm fairly confident we'll be able to get that done. I know not a lot of confidence here in Washington on healthcare, but I am. Okay, so that's sort of a current affairs update on one of the hot political issues of the day. Let me talk about